We want to turn now to something serious in health news. We are just about a week away from the start of Colorectal Cancer Awareness Month, and tonight we're learning that the Erie County Cancer Services Program is going to be handing out free testing kits at 12 local TOPS locations starting next week. In the privacy of your own home, you'll be able to collect a sample and mail it to a lab for testing with a prepaid envelope provided by Erie County. It's all part of their effort to get more people screened for colon cancer. And joining us live in studio is Roswell's Community Health and Outreach Patient Navigation Doctor, Kate Glaser. Thanks so much for coming here on the 5:30 tonight. I appreciate it.
Thank you so much. It's great to be here in person.
This is a serious topic. Explain why people need to get screened.
It's very important to know your risk for colorectal cancer, number one, and also know when you become eligible for screening. And over the last several years, they have lowered that age guideline to 45, which is really important for people to know, especially people of average risk. Part of the reason I bring up that knowing your risk is knowing if your family members had colon cancer in the family. Sometimes communities don't talk as much about health issues in their families, and it's really important because that does change the guidelines of when they would recommend you to get screening and what your risk might be. Screening is our best option in terms of early detection and treatment for cancer, and colorectal is actually one of the most preventable if people get screened in advance.
And I think that was a key word to mention, preventable, because people like to hear that, especially when you're talking about cancer. 45 years old, why that age now?
There has been an uptick in earlier onset of colorectal cancer in younger adults, and in turn, we also know that lowering the age guidelines is really important to catch up with that. It also is a reason that there is a higher rate of cancer being diagnosed, because over the last few years that age range has lowered, so more people are getting screened. It's something to not be afraid of, though. It's something to really talk to your doctor about. There's a lot of options. We're very fortunate in New York State to have the cancer services programs, including the one here in Erie County that can hand out stool-based testing. We work very closely in our outreach programs with Erie County's Cancer Services Program. They're fantastic people over there doing really good work, and they cover anyone who's uninsured or underinsured. And we also have really good options in our community health centers to get people enrolled in health insurance product, know their risk, get screened, and really focus on the prevention component of it.
Let's talk to the people who are watching out there. If you are in a rural area or an underserved community, why is it so important that you want to hit those areas? Is it because you're seeing a higher incident of colorectal cancer?
It's not so much a higher incidence or more being detected in those regions. It's really about access to care. And that's why these connections back to primary care providers and the community health centers in these regions are really important. We work with all of the community health centers in Western New York, and with them, the primary care doctors that are there, they make sure people get into what we call a medical home, and they're looking at the whole person and what they might need to optimize their health care and also deal with social needs and also these access barriers that might exist in certain communities, like rural communities that don't have as many hospital systems or access to facilities like we might have in urban or city areas.
Quickly, if you can tell us, where can people go to get these kits? How can people get tested? And once again, we know that some of these tests are free.
Yes, New York State has a really great website for their cancer services program. Every county has coverage from cancer services. That's one way to go onto the state website and look up cancer services. Other areas are really talking to your primary care doctors or reaching out. We have a lot of navigation programs at Roswell Park. There's also others that exist in the community. A lot of them are focused on breast cancer because there's so much awareness there. We're trying to catch up with that with colorectal as well. But we have online information on our website. We have other, we connect people to community resources in the communities in which they live where they can get screened. That's a really important point for us to make sure people can access the care close to home.
Great information. We will have this on our website, WGRZ.com. This is Dr. Kate Glaser. Thanks so much for coming on the 5:30 today.
Thank you so much for having me. It's great to be here.
Glad you were here.